The following video will demonstrate and explain the skin fold measurement process for men and women. Anthropometric measurements such as the 7-site skin fold test provide general health information and risk stratification. Although it is not too precise, it can be beneficial. For most accurate readings, it is important that the technician is properly trained for the skin fold measurement process. Also, the caliper must be calibrated to avoid misreadings. If patient is too lean or obese, the measurements may be inaccurate. A standard error of plus or minus 3% may be implemented, assuming the techniques and equations have been used properly. All measurements should be conducted in the right side of the patient's body. The sites include abdominal, triceps, chest, mid-axillary, subscapular, suprailiac, and thigh. The abdominal fold should be taken vertically, 2 centimeters to the right of the umbilicus. Once the caliper is on, wait 1 to 2 seconds before reading the measurement. Be sure it is placed directly on the skin surface, halfway between the crest and the base of the fold, 1 centimeter away from the thumb and the finger. Keep the pinch sustained while reading the caliper. The tricep fold is also a vertical fold conducted on the posterior midline of the upper arm. Be sure it is halfway between the acromion and the olecranon process, with the arm hanging freely on the side of the body. The chest or pectoral site is a diagonal fold half the distance between the axillary line and the nipple for men. Keep in mind, women should be 1/3 between the axillary line and the nipple. The mid-axillary is a vertical fold on the mid-axillary line at the level of the xiphoid process. Be sure the patient does not lift his or her arm too high to where it stretches the skin. The subscapular site is a diagonal fold 1 to 2 centimeters below the inferior angle of the scapula. Having the patient reach their arm back may be necessary to locate the inferior angle, but bringing it back down before the measurement. The suprailiac site is a diagonal fold along the natural angle of the iliac crest. You may ask the patient to locate their iliac crest to help you reference the site. The thigh is a vertical fold on the anterior midline of the thigh, halfway between the proximal border of the patella and the inguinal crease. Be sure the patient has their weight shifted to their back leg to avoid muscle contraction. Once completing the 7-site skin fold measurement the first time, wait 1 to 2 minutes and conduct a duplicate measurement to ensure results. If measurements are not within 1 to 2 millimeters, retest the patient. Be sure to rotate through the measurement sites to allow time for the skin to regain normal thickness and texture. The following are the 7-site formulas distinguished for men and women to find their approximate body density. Once the body density is obtained, you must use one of the following common prediction equations to estimate percent body fat on your patient regardless of gender.